Hello folks, Dr. Parker Barnett here with my lovely wife Tammy. We wanted to take a quick minute tonight to talk a little bit about National Breastfeeding Month. And we have a special guest of Nash with us tonight. He's going to help. Things have been really crazy around here for us. It's been an exciting month with a lot of exciting changes that are going to open up opportunities for me and my reach to help people out and expand my coverage area. So pretty excited about that. That news will be coming later on down the road, but we will be announcing that soon enough. So stay tuned. So National Breastfeeding Month. It's the month of August. Breastfeeding is something that is pretty important to the baby, making sure that the newborn child gets not only the nutrients it needs, but also antibodies, basically the start to developing the baby's immune system. Very crucial, necessary, and essential nutrients come from breast milk that are very difficult to get other places. So it's really important for new mothers to try their best to incorporate breastfeeding into their routine with their children. There are instances where that's not possible, and that's to be understood, but we'll try our hardest to incorporate breast milk into the baby's life. So I wanted to talk a little bit about the strains that breastfeeding can put on a mother. I'm not an expert by any means. Tammy, however, is. So I'm gonna default to her on some of these things. But I just wanted to talk a little bit about the biomechanics. Quite often, when women are breastfeeding, they're a little bit hunched over, kind of cradling the child, and often have their head forward, which can put a lot of strain on their back. This is necessary to a point, but the important thing would be not to hold those positions too long and to use devices like a nursing pillow to help bring the baby closer up so you're not arching your back. You can sit up with more correct posture and not be looking down at the baby the whole time. So those are just some thoughts from me as a chiropractor on what the best approach is to handling breastfeeding. So I'm going to let Tammy talk a little bit about it here and turn the time over to you.
Okay. So I know that this is my fourth baby that I am breastfeeding, and I know that the first, go rounds at it, breastfeeding is challenging. People often assume that because it's a very natural and normal thing to do that it should be easy, and when it's not easy, they get frustrated and assume that it's just not for them or that it maybe isn't meant to be. But let me tell you, ladies, it is so worth it to put in the work and the time to learn. It's a learning part for both you and baby to get proper latch and to be able to sort out your routine and to go through often an elimination diet. So in my line of work in healthcare, I see a lot of babies that come in with projectile vomiting and all of these problems. A lot of these babies are formula fed, and not to say that formula isn't wonderful modern day invention that our grandmothers never had, that when we need it, it's there, it's fabulous. But a lot of these babies don't actually necessarily need some of the medications that they're given to kind of get this vomiting and reflex under control. Their tummies are just sensitive, and formula can be kind of hard on the gut. But guess what else can happen, ladies? Our diets, when we're a breastfeeding mom, can irritate baby's gut. So it's important to look at what you're eating, your nutrition, and see if perhaps a temporary elimination diet, say eliminating big culprits like dairy, gluten and things like that can cause inflammation in your gut, can cause inflammation in theirs. So to be willing to put in the time to see maybe there's something spicy in your diet. Some babies don't really love onions and garlic, and it just depends on the child and it depends on the mother's diet. So don't be afraid to experiment with your diet, eliminating things, adding some things, and seeing how baby tolerates it. Because that could be the key to having a super happy, not fussy baby that's sleeping well, is one that is, that's right, one that doesn't have an inflamed tummy and is handling his or her breast milk really well. So also with the postural things that Dr. Barnett was talking about, I would get lots of pain in my ribs and in my upper back from the way I was hunching over and whatnot. So just to use Baby Nash, if you want to help Dr. B, I'm just saying, this is a standard nursing pillow, and sometimes I've even gone as far as to grab another pillow and put it underneath there to really get him to the level, because now he's at the level he needs to be, and I can keep good posture. And sometimes slouching back in the couch is maybe not the best idea, kind of sitting a little more forward to nurse them is. Also, a lifesaver for me has been a side lying position in the bed where you can line up baby. This is not as easy to do with brand new babies, but when they get to Nash's age, he's almost 6 months old. Side lying is pretty awesome because you can kind of keep your back neutral and lie down and be super relaxed, and baby can be comfortable, and you can get them as close as you need them and at the level that you need them to. So one last little tidbit I'll share with you. There are lots of different things that moms have tried to boost production. I think that I hear often of women struggling with production rather than overproduction. Both can be frustrating though. So I always recommend, if you're having any frustrations with your breastfeeding, get to a lactation consultant as quickly as you can. Have them watch you do a feeding. Have them weigh baby before and after so that you can see baby is getting enough food, and make sure that that is the case. They can help you evaluate for things like lip and tongue tie that can create latch issues, that can make it more painful, and that can make baby swallow more air, and therefore create more fussiness and gassiness. There are so many little things that you might not know to look for that a lactation consultant is going to be able to identify and say, oh, here, if we just make this small adjustment, it makes all the difference in the world, and will help you be more successful at long-term nursing. Because as the World Health Organization comes back with recommendations, it is recommended now to go to the year mark if you can at all. Literature used to say you're good at 6 months. Now literature is coming back and saying if you can get them to that first year of life, you're doing your baby such a great service. But some is always better than none. So do what you can. And get in to see a professional. If you end up with some back trouble and back pain, go to your chiropractor. Tell you what, it's been a lifesaver to be able to get some ribs put back into place. That long-term poor nursing posture did not help, and that's been a huge help. Last tip for any of you ladies that struggle with thyroid disease. I know a lot of you have heard of fenugreek is a great supplement to help with milk production, and one that a lot of women have used, and I had used it and then realized that it was actually seemingly counterproductive. I then learned that women with Hashimoto's, like myself, which is a version of thyroid inflammation, it's actually counterproductive to use fenugreek, which was really interesting to me. So I was able to use things like milk thistle and also essential oils like fennel and basil to help boost my production, but lots of hydration, and always make sure that you're getting proper nutrition. Good, clean eating does you and baby good. So I think those are probably my last few tips.
Awesome. She's awesome, folks. I like keeping her around. So thank you for helping me out with that. She really is a wealth of knowledge. And if any of you want to get in touch with her, just send me a message and I will be sure to get you in touch with her. Super talented, amazing woman.
Thanks,
and yeah, I kind of have to say it. But stay tuned to some really exciting news is coming down the pipe, and we'll be in touch with that within the next probably 5 days or so. And we'll talk to you next.